everybody. It's David Kemp, host of your Highway to Health podcast series. Appreciate you being here. I'm excited about today's episode. You know, if you've paid attention to this series, we enjoy bringing on experts and solutions that are innovating in ways to help improve access, experience, and outcomes for our patient community. One of the things that's been a recurring theme on Highway to Health is the challenges and the solutions that are becoming more and more prevalent in the revenue cycle. And when you look at the provider space, from a rise in denials, challenging reimbursement rates, staffing shortages, and other things, you know, our providers are battling on a lot of different fronts right now. Today's episode, we're going to talk about some of the resources and strategies that our providers can tap into to win some of these challenges. And that's why I'm really excited to have our guest on the show today. He's the Director of Consulting at Acclara. His name is Jeff Tanner. Jeff, welcome to Highway to Health.
Thank you for having me. Appreciate it.
Glad you're here. We're going to talk about a lot of things today.
All right.
But let's just set the stage for our listeners. You know, I'm sure a lot of people have heard of Acclara, are familiar with the services and solutions, but give us a high level about Acclara, and then we'll dive into some of these other topics.
Sure. So Acclara is kind of an amalgamation of several companies that were really the best in their space. And like others, we're a, full revenue cycle outsourcing type company. We also do some things, that are specific needs for clients. We also have a consulting division, which I'm a part of, that can help clients with, some really specific issues in their revenue cycle or in leadership roles, filling those vacancies for a period of time. So we do quite a bit. We're very, very engaged in revenue cycle.
Yeah, and y'all have some great experts on your team, whether it's yourself, Ryan O'Hara, Dana Mojica, and others. And so bringing that expertise to the provider space, especially during these challenges, is probably pretty important.
It is. And, the good thing about Acclara is we find focused experts. So you've got the different, areas of the revenue cycle. And while myself, for example, I know all three areas, but where I really excel is in this area, right? But I have a consultant who they excel here. And so we join up as a team and we come in with the person that's got the best expertise in that area.
I mean, it takes a village.
It does.
There's so many challenges that, there's probably somebody that has endured or solved that challenge before, and leveraging that expertise really helps these providers. Tell us, so we're going to talk about denials and the increase that we've seen in those rates and the challenges that presents. But let's talk about the consulting side of it for a little bit, because I like y'all's approach at Acclara in terms of, flipping this dependency. And so talk a little bit about, what that consulting engagement looks like when Acclara partners with a provider.
Sure. And, to preface that, I would say an important thing for providers to know is how to create a successful consulting engagement before the consultant steps on the floor. That's the most critical part of a consulting engagement, is knowing what it is you're trying to solve for and having the outcomes and the measurements of how you're going to show success. So I would say be very careful about how you engage before you engage. But the way I've operated for many years, and many of my colleagues, all of us have pretty much the same list of areas we're going to go look at. I know this is a problem at the 10 other facilities I've been at. It's probably a problem here.
Yeah.
Let me go look there. And I do tend to find a lot of the same issues that plague most hospitals. They really haven't changed all that much, but we are seeing some new, we'll call them strategies by insurance companies that are increasing denials that have a very difficult path to recovery.
I think you touched on something there that I think it's important for the entire provider community. when partnering with yourself and companies like Aclara, you guys have a unique perspective, almost a bird's eye view of what's going on across the provider community, because you work with so many different providers and you get to see things at a higher level, which gives you ideas on where opportunities might be at a specific provider. The provider, alternatively, you know, they're solely focused on their data, their revenue, their reimbursement, and sometimes they don't get that wider picture. And I bet that pays off when you bring that perspective.
It does. A lot of times the providers know they have a problem, but they can't put their finger on it. And a lot of that is because there are difficulties with data. There's, how do you analyze the data? What outcome do you see out of that data can be very different depending on who you ask. And if you're using, for example, an 835 source, versus your system that you're using, you can end up with varying things, and it's hard to know what the truth is. And so when we come in, a lot of times there aren't specific metrics. It's just, please help us. And we try to do that. So we go for the big things first. What's going to potentially bring in revenue as quickly as possible? Because ultimately that's what we need to do. But then on top of that, we've got to document everything. We have to train the staff that's there, because when we're gone, we don't want that bucket to fill back up.
Right.
So we leave you with the tools and the knowledge necessary to stay on top of that area and the things to look for in the future. And that's very important. Any consultant can come in and fix your problem today. But is it going to be a problem in 3 months when they're gone?
It almost always is if they're not, it's all those three things. It's people, process, technology that's wrapped together that provides some sustainability in that solution.
And unfortunately, when somebody retires, all that knowledge generally walks out the door.
Brain drain.
It is. And then, we end up hiring a young person that's a go-getter. They're really, passionate, but they're not yet experienced in all of the things that go on in healthcare.
Yeah.
And so who's going to train them? A lot of times it could be the person next to them who didn't get much training themselves. And now you've duplicated that same inefficiency into your new staff. And it's getting harder with, staffing shortages are a reality for everybody, not just healthcare.
You're right. We need to, we talk a lot on this podcast about how we could do a better job in healthcare, revenue cycle included, to start generating interest in a younger demographic to get into the industry, because it's first of all, you're needed. Secondly, it is rewarding, and you have a bigger purpose when you're in the healthcare industry. And I think if younger people were more aware of those things, maybe we could attract more and even better talent.
I couldn't agree with you more. And I think that's the biggest selling point we have, is there's career trajectory in healthcare.
Right.
You have a path that's only limited by yourself. There are a lot of opportunities for people starting a career that they can move up. I think there's a very exciting sales pitch there.
Yeah, I agree.
That we don't typically get out. Some of my clients that are in smaller areas that have like a community college, I say, let's get with the dean. Let's talk to them about offering classes in hospital revenue cycle and hospital management. Let's talk to them about offering these things, because now you have a talent pool coming out with the proper training that you can put in seats right away. Now, they'll still need to learn the nuances and the realities once you're on the ground, but nothing against Masters of Health Administration. I've worked with a lot of people that have those degrees, and they're very smart people. Mm-hmm. The thing that has always amazed me, though, there's not one revenue cycle class. Not one. And if you're going to be a CFO, if you're going to be a CEO, you're going to be a COO, you better know your revenue cycle.
And there's a difference between education and immersion.
That's right.
You can learn, but until you experience it and are immersed in it, you really don't know the game.
Yeah, I can tell you how to fix this type of denial, how to fix that one. Oh, but wait, there's this little different thing that we didn't tell you about. That in that case, it does this. So it's very hard, but it's rewarding when you finally get that level of knowledge that you can really do an exceptional job and make a difference, not just for the hospital, but for your patients.
Exactly.
You're already there for probably not a great reason. And then if you have billing issues and trouble, that's just making it worse. So if we can make that better for the patient, that's exciting too.
Yeah, we often talk about this, the experience that we have when interacting with healthcare, and we focus a lot on the experience when care is being rendered or services are being provided. But like any other industry, the surprise in the mail or the unexpected balance, patient responsibility, that impacts the experience almost more than anything else.
It does. I remember when I was, at my first hospital as a CFO, and the guy who was my lead, my trainer, he told me the most important thing in the hospital for patient satisfaction is the cafeteria. It's the food. He's like, it always comes down to the food. But I would challenge that in that it's when that patient gets that statement. They can see that unexpected balance. And we've got these new things like price transparency, no surprises act. These are supposed to help solve for those things, but it's just not meeting the mark of what we really need to do.
Yeah.
Those are great ideas, great concepts, and I think we need to be there, but there's a lot that we've got to do before those are really helpful.
Yeah, because those things are usually happening at the front end. That doesn't account for the denial that happens on the back end.
Exactly.
And the denial has been the 800-pound gorilla, in revenue cycle for as long as I've been a part of it.
Absolutely.
And they always evolve, right? And they're changing colors all the time, so they're hard to pin down. But I'd like to get, your take, your opinion on how we could start to shift that responsibility and put some leverage and some responsibility, put some leverage for the provider, put some responsibility back on the payer. How are you working with providers right now around maybe even specifically like COB denials?
Absolutely. So the denials are my passion because, they're unavoidable. We're always going to have them. We're not getting to that point. But if we do our jobs properly, we have an opportunity to really be effective at challenging these payers because they're sitting around thinking about how to challenge you. You need to be doing the same thing. And what's interesting, David, is when I go to a client today and I get in their system and I look at a denial report, the denial categories that I see today in 2023 are the same ones I was seeing in 2010.
Wow.
The same high-level grouping of denials. And, some facilities try and dive deeper and say, okay, what does that one really mean? Because, we have standardization in these claim adjustment reason codes, but then the remarks different for every payer. So you can have 5 remarks from 5 different payers mean the same thing. You've got to map to understand exactly what that payer is doing to you at every payer. And it's not a small task.
No.
But the dividends that could pay are worth the effort. And let me explain. So typically, coordination of benefit denials, which is something I've only been seeing for the last 5 years, and it's getting worse. Hundreds of millions of dollars being lost at hospitals because we eventually give up. They end up in bad debt. So this is the most interesting concept to me. So a patient comes into the facility, we provide services, we provide care, and we bill their insurance company. And the insurance company says, we have reason to believe that David might have some other insurance coverage. You need to get with the patient and tell them to call us. Wait a minute. The patient pays their premium to you. I provided a service, and you want me to call your customer to get them to call you. And then it just becomes a shell game.
Yes, it is.
We actually do this. We call the patient generally 3 times. We send a couple of letters. And then the unfortunate problem is when we don't get the response, the hospital really has no choice but to flip it to self-pay. Ultimately, we're responsible for our bill. Typically, when we do that, we get the angry call. And we're the ones that look like the evil one,
right?
Because we've started charging you for something when you know you have insurance. We explain the situation, your insurance company, you need to call them. They believe you have other coverage. Can you call them and clear this up? So they call their insurance company. And then the insurance company says, oh, there's no problem on this side. It's the way they build it. So we get another angry call. And we're saying, trust us. We're going to call your insurance company. We call the insurance company. Patient never called us. It literally happens every day. It's a shell game. And the problem with a coordination of benefits denial, there's no appeal. You can be a perfect patient access department and ask every patient that walks in that door, do you have any other coverage? Is this a work-related incident? Is this a vehicle-related incident? Did you have a slip and fall? You can ask all the right questions. Patient says, no other coverage. Does your husband have coverage? Does your spouse have coverage? Nope, this is it. This is our coverage. You can do everything right and still get that coordination of benefits denial. And the patient will probably get a letter from the insurance company. Doesn't make sense to them. Yeah. I've got insurance. What do you mean? This could be covered under another insurance. And the patient's like, what do you mean? I don't have any other insurance.
Yeah.
And so they don't know what to do with it. It probably just goes in the waste bin.
Yep.
And then we're stuck. So here we are working now for our biggest nemesis, the payer, working on their behalf for them to do their job. It's a horrible, horrible thing, and it's costing us hundreds of millions, over $1 billion a year across the country. It's just insane, the amount of money lost, because eventually you cannot continue to put effort into that claim because you got 10 more that came in today.
Right.
All we can do is our best effort.
The thing that this makes me think of, when I was in revenue cycle, we talked about denials being a product of garbage in and now garbage out.
Correct.
Right? Where we're not getting, you have a patient who's in distress, and that patient access coordinator or representative is just trying to get them the care that they need as fast as they can.
Absolutely.
We'll get the data later. We'll get the information later. We'll solve it later. That led to denials down the road. But providers and partners of providers like Aclara have gotten better at coordinating that data up front and getting accurate data up front. So what's the next phase? What's the next game? It's the coordination of benefits.
That's right. That's going to be the next one. The other types of denials that we're all familiar with, authorizations.
Right.
That's another one you're going to lose every time. You didn't get it authorized, you don't get paid. And so, we try, and every hospital works very hard at making sure they're covering everything. The problem is the insurance company has a certain procedure now that seems to be getting more more common. They're getting more bills for that procedure. So all of a sudden they say, okay, this requires pre-auth now. Well, unless you have a revenue integrity department that's on top of everything, a CDM guy that's on top of everything, you're probably going to miss that until you get the first batch of denials. But then I'm just working an authorization denial. I'm not thinking about the fact that does the system prompt the staff to call for an auth. There are times we get, eligibility information, no auth required, denial, auth required. Then we have to fight that, and we'll win those most of the time. But it's draining. It's draining. You're doing this every day. And so when do you have the time to work on your business? We're so busy working in it.
I love this. I love this idea. I want you to really dig into here, because I've heard it from you and your team about working on your business is important. Mm-hmm. Working in your business is even more important. I want you, because I've been inspired by it. Explain it to our listeners what y'all mean by that.
So I've had some good mentors along my career, and I kind of feel like if I can retain one nugget from them, I've learned something special. And this one gentleman had told me, he says, Jeff, you're doing a great job running our business, but what are you looking at ahead of the game? And I was like, more clients, right? Let's get more revenue.
Yeah.
Because I think that's what he wants me to say. But the reality he was explaining to me is that unless I spent time working on our business and getting even better at what we were doing, then I was always going to be behind and somebody was going to surpass us. Now, at that particular time, I was running a workers' compensation company. And I'll just say it, I believe we were the best in the country. We went behind other people and we always found more money. We really, really prided ourselves on being the best in that niche market. But you look at it today, it's an entirely different industry, right? And so I had to start learning to work on our business, not just for strategy going forward, but what's working, what's not. The problem is we got day jobs.
Yeah.
We're so overwhelmed with, these work queues that are filling up as fast as we can take some out. And so when do you get that time? And that's where, I happen to believe, not just because I'm a consultant, but I happen to believe that's where a consultant can be helpful.
I agree.
Now, some consultants come in and they tell you, oh, here are the problems you got to fix. Good luck. Well, that's not really helping. You need consultants that can come in and identify those problems, they can fix those problems, and they can help you to have the knowledge to continue when they're gone.
Yeah.
That's a successful consulting engagement.
I think that's a lesson for any industry, anybody.
Agreed.
Working on your business. And like you, I've been fortunate to work with some great people, work for some great people that haven't phrased it in that way. I really like the phrase that you're using, but the idea is the same. 9 to 5 is your 9 to 5, but anybody that's passionate and truly successful and game changing is always working on the business, not just in it. And so when I've heard you guys talk about that, I think it's important to share, because that's a differentiator for you guys.
And think about it too. We're facing staffing shortages, right? So when we do have an issue that we want to work on, right, as a hospital, what tends to happen is we go to a person who's already really busy and we say, we need you to also take a look at this because we don't have anybody else. And so now you end up stacking work on top of work on top of work. So how do you overcome that is the biggest challenge. I'd love to work on my business, Jeff. Tell me when I'm going to have time to do that. And, my argument is if you don't make the time, you're always going to be behind and you're going to continue to get further behind. So
the competition,
it's a challenge.
The competition, call them the competition if you'd like. The payers are working on their business.
They are. Every single day they're working. I tell you what they don't have is they don't have overstaffing. They don't have understaffing. They don't have the problems we have because they can afford to staff up at whatever level they want, right? We cannot. We are facing tighter and tighter, reimbursement rates, and that's, I don't believe, going to get any better, right? All we can do is hopefully slow the pace. We're getting payers who are becoming better and better at not paying the bill. And, just another example is, what about our contracts? How often are we looking at our contracts? How often are we looking to see if we're getting paid what we're supposed to get paid?
Right.
And, we think, oh, I know what we need to do. We need to go get this new system. This new system will take care of all of that. All of these systems out there are pretty good. None of them are perfect. They all have issues. It's about your setup and it's about knowing what to set up. And it can do a lot of things for you, but I've never seen that system yet. I've never gone in to a hospital where they're like, we got every report you want. Yeah, we're doing that. We're doing that. Of course, they're not going to call me if they're doing all those things. But, the point is
there's not a silver bullet out there.
I haven't seen it,
So tell me, tell our listeners too, the foundational building blocks that a provider, a revenue cycle needs to build. Like talk about what those strong foundational blocks would be. How would you advise them in a few words?
Well, you mentioned earlier that we used to look at denials as garbage in, garbage out. And what that really meant was, All denials come from patient access, which patient access people hate to hear that because it's not generally true, but it can be a problem. But we teach people at the front end, our first line, we teach them, well, you put this here, you put this here, we put this here. Have you ever seen insurance cards, how many of them look alike,
yes.
how many of them are different? And yet this person's supposed to figure out whether or not we take that insurance by looking at a card. Or they've got a notebook they're supposed to thumb through to see if that card. It's a difficult job. And I'm just going to say it. I think we need to elevate the level of talent we bring in there because they really are our first line of defense.
Yep.
You know, they're entering demographic information. We rate these folks on how fast did you get through the patient? Well, is speed always the right answer? Or is accuracy more important? I mean, we got to think about those things, right? So you have to train your foundational first point of contact. They need to be super trained to get everything that we need them to get. Your health information management and your coding, they've got to be efficient. Nobody looks at them. I mean, we look at coding, we do that, right? But do we look at the efficiency of how our physicians are documenting? Do we look at the efficiency of how quickly HIM is getting things scanned in so the doctor can sign? It's all of these things, right? And then on the back end, are we just expecting denials? Are we trying our best to avoid that denial before it ever goes out? That's working on my business. If I take the time to look at my denials and I start seeing, hey, we've seen this before, let's not do that again. We know this payer's gonna, they're gonna deny that. So let's fix what we need to fix now so my denials team can shrink. So it's really the same fundamentals that it's the basic blocking and tackling. Where I advocate for a difference, I think you absolutely have to do this. Where I'm advocating for a difference is let's also now start peeling back the onion and looking at how do we group denials? How do we get proactive about avoiding denials? Everybody promises the moon, but I'll tell you the answer. The answer is doing the hard work to get there.
Hopefully I'm not putting you on the spot here, but we had a good conversation before we started recording about how the providers could start playing the game at a state and federal level too.
Absolutely.
Are you comfortable sharing some of those things?
Sure, because I do think it's important. Because I don't know if we're all aware of this, but the insurance companies, they entertain your legislatures, both at the state and the federal level. They're talking to those guys and ladies all the time. Why aren't we? We're depending on these organizations that maybe represent hospitals or the healthcare industry as a whole nationwide. But we really have to get back to the local level. And we have to say, listen, what's going on in the metropolitan areas is not what's going on at my rural hospital, or vice versa, right?
Right.
And so with these coordination of benefits denial, well, who determines whether an insurance company can sell their policies in your state? It's usually, some comptroller of the Department of Insurance, or it's your Secretary of State's office. It can vary by state. When I've called these guys and I've talked to them just out of curiosity of having a conversation, they have no idea what I'm talking about. They say, well, can you get the patient to call us? I'm sorry, you're not understanding.
Missing the point.
You're missing the point. This is, the patient's the one that's impacted, but it's these two entities here that are having this battle and they get very interested, but a consultant calling them isn't going to be enough.
Sure.
I highly, highly recommend that hospital executives start getting with their local representatives at the state, explaining these challenges, getting with their federal representatives, explaining these challenges from the hospital level, not meet and greet photo ops. I'm talking about, let's talk business. Let's talk about the things that are impacting healthcare that you need to know when you're passing the budgets.
Right.
We've got to be having those conversations because the insurance companies are.
Yeah, I think that's a game that's got to be played.
Mm-hmm.
It's, in a way, it's time to roll up the sleeves and play the same game.
I agree.
And starting at the local level, I had somebody earlier today tell me, healthcare's local. Now with virtual care and telehealth and these things, we feel like it's gotten to be, more of a global thing where you can interact
Mm-hmm.
But when you really need care, when you're in a situation where you have to have care, what do? You go see somebody that you're close to.
That's right.
And we're all patients.
Mm-hmm.
And I think our on the provider side, those stories are more powerful than the story of the health plan. And they play their part, all those things. Nothing against them. But we're fighting with one arm behind our back if we're not.
Well, and the thing is like you're talking about, you're right. If I really am in pain, I'm not calling somebody on the computer.
Right.
I'm going to see somebody, right? But if you think about it, the hospitals, especially in the smaller communities, the people that are manning the patient access desk, the people working in the billing office, all these people are members of that community. They're going to see their neighbor. They're going to see their friends. And think about how that affects them when they have a bad experience at the hospital.
Yeah.
Because somebody doesn't know what they're doing or they've created a problem. We haven't explained everything. I mean, it can be challenging. These folks at these hospitals, they're working there because they want to help their community.
Yeah.
They just don't always have the tools to do it.
Yeah, really well said. From staffing shortages to denials to just not playing the game at the same level as these health plans, we've talked about a lot.
Mm-hmm.
But if you could leave our listeners understanding one thing, what would that be?
Well, it's probably going to be a repetitive summary of what I've said. We're not going to get better at the challenges we face if we continue to do things the same way we have for the past 2 decades. We've got to evolve. And what I mean by that is we've got to start thinking of new strategies and different ways to look at things, working on our business. It's hard, you don't have time for it, but you've got to find the resources and the time to do it. Otherwise, we're going to continue this battle on and on and on. I would love to see my company probably hate this, I'd love to see every vendor in healthcare have to go away because hospitals are doing their job so effectively. I mean, the reality is that's not going to happen because it continues to get worse. And it continues to get worse. And with the things you mentioned, the staffing shortages, the lack of education programs to teach people our business, the denials and the payers' power, all of these things are only going to get worse. Yeah. They're not going to get better. And so we better be fighting for ourselves and facing these challenges, not just head on, but proactively.
Yeah.
We got to get in front of what that payer's going to do next. And you can do it. It's all about the data. It's all about taking the time and figuring out a plan and a strategy and implementing that.
And that only happens when you take a step back, you work on the business, not just in it. And, one thing I would add is reach across and talk to somebody else that, is at another provider. I mean, providers have the data, the same data that the payers have. The difference is they have it nationwide, sometimes globally, and we're looking at our internal business only, which puts us at a disadvantage. If you can take a step back, work on the business, for your facility, but also on healthcare in general, and as a provider in general, I think you could have an opportunity to gain some ground. So thank you for being here.
Absolutely.
Thank you for sharing these things, and I've really enjoyed the conversation.
I did too. I can really get engaged in this stuff because I'm passionate about it.
Well, you're welcome back anytime.
All right, great. Thanks.
Thank y'all.